Hey, good morning, Baguio. Good morning, Philippines. Welcome to another episode of Health Matters, where we discuss wellness and health issues that are relevant to our community. And with us today, I see Doc Tong.
Yes, Manang Lucy, magandang umaga po sa inyong lahat. Ako po ulit sa inyong Doc Tong at maganda po ang topic natin ngayon. It's about mental health. At makakasama po natin ngayon, aking kaibigan po. She is the department chairperson of the Department of Psychiatry here at Baguio General Hospital and Medical Center. At dito rin po siya nag-training ng kanyang psychiatry residency. At ngayon po, makakapanayan po natin siya at papakwento po natin ano bang meron sa mental health. Napakahalaga po ito, lalo na ngayon. So, ipakilala po natin siya ngayon, Dr. Gwendolyn C. Doc Gwen, magandang araw sa iyo. Ano po ba itong mental health and sinicelebrate natin itong mental health week?
Itong second week of October is Mental Health Week. So, we are celebrating it and ang special na theme ngayon is we are focusing on mental health in the workplace. We have a lineup of many activities. So, starting this Monday, we have a pet show and then tomorrow, acupuncture and massage. And then from Wednesday to Friday, we'll be having a fair. So, there will be several concessionaires who will be joining us. And then we will also have games, fun games for employees and for the public as well. And then magkakaroon po tayo ng fun run on Saturday, October 12.
So it's a long lineup of activities, Doc.
Yes.
It's one whole week pala. Oo. But previously, you also mentioned that, is it October 8th? That's going to be the international...
Oh, I was talking about suicide prevention.
Oh, yeah. Oo.
Tapos na po, it was September 9, Suicide Prevention and Awareness Day. The theme naman is, it's a triennial theme, so from 2024 to 2026, the theme is changing the narrative. So it means na we are all encouraged to talk about suicide because not talking about it does not make it go away.
Yeah, previously, I don't know if it's still current. May stigma, Doc. It's something that most people wouldn't like to discuss it. Feeling nila nakakahiya na pag-usapan yun. Like, pwede naman pag-usapan ang hypertension at saka stroke at saka heart disease. Like, they're walking on eggshells pag ang pinag-uusapan ay yung mga bagay na pertaining to mental health. For us po, at saka ating viewers to understand, ano ho ba ang mental health? Ano ho ba ang sakop nito, Doc?
It's part of the overall well-being of a person. Sabi nga nila, there's no health without mental health. You can be physically healthy, but if you're not mentally healthy, then you're not considered na healthy. It's an aspect of health.
So, ano ho ba yung common mental health disorders po?
Kung nag-usapan po natin ang disorders, they are just like any other illness. Kaya nga nung sinabi niyo, ma'am, no, na everyone can talk about hypertension, diabetes, pero why not talk about mental illness? Pero nga, we're changing the narrative, no? So, siguro generally lang, no? So, there are disorders called mood disorders. So, maraming klase ito, depression, bipolar. So, it simply means instability in the mood. And then, meron naman po yung tinatawag na psychotic disorders like schizophrenia. Okay, meron din yung anxiety disorders. Marami pong klase ng marami pong classification.
What is very commonly heard is the increasing incidence of suicide. Where does it come from? Anong klaseng disorder po yun?
So, ang suicide po itself is not a distinct disorder. It can be a symptom of these disorders. So, mga patients with psychosis, pwede silang mag-succumb sa suicide. Depression, pwede rin, bipolar. You know, it is like the result of several factors. So, it's not considered a disorder. So, you have to look for the reasons na nagko-contribute sa suicidality ng isang patient.
So, nung nakaraan po kasi, particularly when we were going through the pandemic, a common report was tungkol sa suicide po. Parang mas dumami po ang cases ng suicide at saka may po yata, these cases were involving younger people. Doc, ano ho ba ang prevalence ng mental illnesses or disorders?
Kung prevalence, ma'am, ibig sabihin at any point in time, no, you look at this population, no, ilan ang mga patients dun. So, ang pinakamadami so far will be the anxiety disorders, maybe up to 40%. So, ang anxiety disorders, they are common, no? So, mga generalized anxiety disorder. And itong mga patients with anxiety disorders, they can suffer those disorders for years without seeking consultation. So, ibig sabihin, they're not so impairing as compared to the other more severely debilitating illnesses, like probably schizophrenia, which is less than 1% in the population, or bipolar disorder, yun din, a little less than 1%. So, 40% yung anxiety disorders, roughly, and ang depression, siguro sabihin na natin, to 20%, sabi nila, even more for women. Siguro because of the expectations of the role of women, yung others na is schizophrenia and bipolar, less than 1%. So, hindi naman sila ganun kadami, no? Pero most of our patients here are patients suffering from schizophrenia and bipolar, and yung mga severe na mental disorders, because we are the center for psychiatric care. Pero in the community, ganun po yung prevalence nila. So, ibig sabihin po, ang daming mga patients with anxiety, they do not get help. One of the reasons is yun, stigma, and yun nga, yung a lot of these people kasi can cope.
Highly functional pa rin. So, autism is not definitely part of this mental health scope.
Oh, it is. Autism is part of it. It's a mental disorder, but according to literature, women present differently from men. And I think women are more highly functional. So there are a lot of people, even professionals, who suffer from symptoms of ASD. We call them ASD, Autism Spectrum Disorder, because it's not the same for everyone.
Nabanggit kanina ni Dr. Gwen yung stigma.
Okay.
Mga 6 or 7 or 8 years ago, natatakot yata yung mga tao magpa-check up. Pero nagkaroon tayo ng mental health law. Malaking contribution yun. Kung hindi na isa batas yun, baka hirap tayo ngayon. Ano nang naitulong ngayon ng mental health law, Doc Ben, sa atin?
Since the mental health law, there are many changes that have been instituted. So one is, it has been mandated that the National Center for Mental Health will be the overall coordinator, and the one who will be the overall in charge of mental health programs.
National Specialty Center.
Yes, it's the National Specialty Center. So after the National Center for Mental Health, there are advanced comprehensive care centers, and then after that will be basic comprehensive care centers. So these comprehensive care centers should be able to manage patients, emergency patients, probably even admit them to acute psychiatric units. And Baguio General Hospital is identified as qualifying for advanced comprehensive care center. And because of that, we have a 40-bed inpatient ward, but it's an acute psychiatric unit now. So, sabihin, it's not intended for patients to stay here for a long time. So, it's only until they will be able to be managed by their families at home. So we also have a training program and a training program for residents, psychiatry residents, and it's accredited by the Philippine Board of Psychiatry.
So, Doc, when nung nasabi mo Advanced Comprehensive Center ang Baguio General Hospital, cover ba niya ang Cordillera lang or buong Northern Luzon?
Yeah, covering Cordillera.
Cordillera. Kasi kung ako may mga simptomas akong nararamdaman o nakikita ng mga relatives ko na baka kailangan ko magpa-check up, kailangan i-navigate yung pasyente kung saan natin i-refer. Lalo na ngayon, nagiging aware na tayo sa mental health because of this mental health law. Tsaka malaki naman itong Baguio Gen, itong may Department of Psychiatry. Paano natin sila papupuntahin dito? Yung referral network sana, Doc Gwen, kung paano yan?
We are catering pa naman to referrals from barangays, etc. But then, we are also encouraging patients sana na to go through primary health muna, pupunta sa barangay, titingnan ng mental health officer, and then the mental health officer kasi sana will be able to manage the patient. Whatever can be done at that level, kung hindi kaya, dasatan na
Dadalhin dito. When you say primary health care facilities, ito yung mga nasa barangay, Doc? Yung mga health center sa barangay. Oh, so they're also trained. So they don't have to come to bghmc kaagad.
Paano ko malalaman na kailangan kong pumunta sa isang psychiatrist?
The first thing siguro, they can approach their municipal health officers, the barangays, and then even the nurses, sana kasi trained also in HCAP, no? And the MHO can make a referral. Or yun nga, yun din, no? They can come, especially within the vicinity and very accessible naman ang Baguio General Hospital, they can come here. What I advocate is it's best for patients to consult here kasi consultation or treatment of mental health problems is not just one consultation. It's going to be long-term. So your relationship with your mental health provider is going to be long-term. We have naman BGH wherein we have many psychiatry residents and then they are accredited na residency training and we consultants are supervising them. So, meron po tayong tele-appointments. We have to clarify that we don't have online na consultation anymore. It's already face-to-face. But then, before you come for consultation, it has to be there has to be an appointment. So, meron po tayong link so that they can secure an appointment. Okay? And for those naman na urgent or kunwari emergency, hindi kailangan na appointment. They can go straight to the ER. Aside from that, I'd like also to say na meron din po tayong mental health crisis hotline. Nag-start lang po itong September. No? It is mandated by the law because we are an advanced comprehensive care center. So, it's only from 8 a.m. to 4 p.m. So, this is the number. No? This is a mental health crisis hotline from 8 a.m. to 4 p.m. only. After 4 p.m., you can contact NCMH. And I'd also like to inform our televiewers kasi yun po yung madalas na nakukuha namin na this is not for appointment. It's not for tele-appointment. Because if you call this hotline for appointment, the call will be dropped. So, this is for emergency cases, mga suicidal or patients who have self-harm thoughts.
You mentioned after 4, they call NCM. Ano po yung NCM, Doc?
Okay. NCMH is National Center for Mental Health.
How are they accessible?
Yes, it's 24/7 po. They also have a Facebook page.
Itong ma'am, itong Manang Lucy, itong crisis hotline, kung alam niyo yung Golden Gate, ibang dami tumatalon doon. May telepono doon eh.
Ayo.
Na pwedeng tumawag.
Oo.
Minsan bago sila tumalon.
Sa US.
Pwedeng yung pasyente pala mismo ang tatawag. Or pwede rin kamag-anak or pwede rin. Going back, Doc Gwen, ano ba yung mga symptoms ng hindi healthy yung mental health nila?
Yung pinaka-common from experience no is the poor sleep. Kapag
Poor
hindi
sleep.
nakakatulog, yes. It's the most sensitive and pinaka-common and most neutral na parang, di ba, hindi ako nakakatulog kaya ako magpapacheck sa psychiatrist.
Okay.
Pero pwedeng may mga naririnig na voices pero hindi yun ang sasabihin nila. Di ba? Parang yung kakahiya kasi kung sabihin my voices. Yeah. That's why, yun yung ginagamit namin ni symptom. No? And that's also what I advise ko sabihin na, two of my relative ako, may narinig na voices. Ano nila, pero kumusta ang pagtulog? Hindi daw siya nakakatulog. Sige, hindi ko. Aside from that, will be, loss of interest also or pleasure in activities. Yun ang very common sa depression.
Pwedeng biglaan, ano? Dati namamasyal,
yes.
Ngayon nagkukulong. Ganyan yun, ano? Loss of interest.
Or kaya insidious, parang dati in-enjoy ko yung manood ng TV ngayon, ayaw ko na. Or in-enjoy ko dati na nakikipagsalamuha or lumalabas with friends, ngayon, parang ayoko silang makita. And then, yung mga mga suicidal thoughts. So, we're talking about depression na kasi. Yung mga suicidal thoughts naman, usually, parang they may occur soon or pwedeng later. And then, this is something that I also always educate my patient. No? Kaya kung nagtatanong ako, ang suicidal thoughts, they are symptoms. So, the way I ask is, are there times na you think about hurting yourself, baski ayaw mong isipin? That thought persists. Because that's a symptom. Oo. Yeah, that's a symptom.
Yes.
Maski kaya sasabihin ng patients, ayokong isipin. Pero nilalabanan ko. Yun pala. Nilalabanan ko.
Aside from that, walang gana, meron pa bang ibang symptoms?
So, sleep, function, sociability nabawasan, hindi na makafocus sa work. Poor concentration sa work, loss of interest. Yan ang mga common, no? Tapos alam naman natin sa mga more severe types like psychosis na tinatawag kakaibang experience like yung mga voices. Ang tawag po is auditory hallucination. So, yun po is hindi lang po nasa isip. Parang yung may pinatawag sa'yo pero wala. Meron talaga.
I see these patients kasi sa ENT.
Ay, oo.
May umuugong, sa tenga ko. So, sasabihin, umuugong po ba? Paki-describe yung naririnig.
Yung ugong.
Boses pala, hindi ugong. So, it's beyond my expertise na I refer to the experts sa psychiatry.
Yes.
So, hallucination, ano?
Minsan naman may tumutunog, tinnitus, okay, ENT mo.
No. So, mas naging aware na kasi ngayon eh. Lalo na yata itong mga younger generation, mas aware na yata sila compared sa generation natin.
Yeah, actually, from very young employees to older employees, parang ano sila nga parang there is a common concept that the younger generation, they are the weaker generation na sinasabi na very sensitive sa mga ganyan. And then also because probably iba na yung mindset nila. But also because probably they're more aware of what can stress them. Habang kami, nung generation namin, pag sinabing tapusin natin ito, no matter what, we will all stick together to finish like, a task at work. But at the same time, the other aspects of our life suffer. Probably ang mental health din namin. But at the time, kasi mababa nga yung awareness, ang causes ng mental disorders na yan. Parang we're blind to that.
Yung generation kasi ngayon, mapagsabihan lang daw, mapagalitan lang daw, ito na yung may mental
They're so
health
sensitive
issue.
now.
I don't know. We need to understand their generation.
Yes.
Yung patients namin noon, iba sa ngayon, no? Parang generally classify patients as psychotic patients, non-psychotic patients.
Mhm.
So, mga psychotic patients, yun yung mga more severe, yung mga non-psychotic, yung mga anxious lang, depressed, gano'n. Hindi sila severe, no? Na walang masyadong disruption sa reality testing. Pero at the moment, mas madami ang non-psychotic patients. And yun nga, mga younger generation. And may mga patients pa nga ako na younger, kunwari mga young adults, tapos, or even mga adolescents, na gustong magpa-consult, pero yung parents ay ayaw. Because the parents are the ones
Adolescents na to.
who are
Talaga?
stigmatized.
Yun. Yun yung generation ng parents kasi compared to sa younger.
Yes.
Parang nakakahiya if somebody in the family is mentally ill.
Most probably yung stigma stems from cannot pinpoint what's wrong with that person kasi unlike bingi, no? Sasabihin ng doktor kasi ito ipapakita mo yung ganyan, may problema sa ear. Pero
Nakikita
may arthritis yan kasi
Masakit.
sa x-ray meron.
Nahawak.
Yeah. Pero that's why we are really emphasizing it's an illness. It's because of the neurochemicals in your brain. Kasi neuroanatomical, ipasitis scan mo, MRI, naman.
Normal.
Except kung siguro kung PET
Kung
scan.
may
PET scan po kasi ma'am, imaging, nakikita po kasi yung may part of the brain that's active, mga ganon. Ang tao kasi masatisfy na doon pala yung problem. It's not you as a person.
na-mention kanina, Doc, when yung tungkol sa parents, ayaw, gusto ng bata.
Oo.
May role ba ang genetics? Is this hereditary, itong mental issues, mental health issues?
So yeah, that's an important point to discuss. Ano? So just like any other illness like diabetes, meron siyang genetic loading. For example, may mga bumabagsak sa board exam, hindi lahat nagkaka-depression. Di ba? So what is that difference? So there's a genetic predisposition. So yun din ang in-emphasize namin. Hindi po yung sakit ang namamana. Kasi kung sasabihin mong sakit, kung may depression ang nanay at tatay,
Dapat may depression
Oo,
na.
lahat
Yes.
ng
Wala
anak
naman.
may depression
Yes.
din.
So,
Oo.
it's-
So yung upbringing may effect din.
there is also
Meron din.
din kasi mayroon ding mga twin studies at birth na hiwalay sila, di
Yes,
ba?
yes.
Yung itong isa nagkaroon ng depression, yung isa wala. So it's environment and genes.
So it's an interplay of genetics
Yes,
and
oo.
environment. Ganyan talaga.
So, yung sinasabi yung multifactorial din, po,
Andyan
Doc?
na siya.
So, it can be caused by several factors.
Yes po.
Going back to mental health in the workplace, you mentioned earlier that that's the focus this year.
Yes.
At some point in my corporate life, I experienced some kind of burnout. Yung parang feeling mo, wala ka nang ibibigay. Is that a symptom of a mental disorder na? Or is it a form of depression? Ano po ba yun, Doc?
Burnout is common po, but it's not necessarily po a symptom of an illness kasi kung burnout po ang ibig sabihin po, ang stress, ganito po kasi, so we go back first. So we all have resources, di ba? Resources, and then may demands at work. Okay?
Mm-mm.
Kung sobra po yung demands at work, nabibigay mo na lahat. Okay?
Mm-mm.
Hanggang sa naubos ka na yung tinatawag na burnout.
Mhm.
And ang
Oo.
burnout po, it will not occur naman within 1 week, lang within 2 weeks.
Yeah.
It can occur after a long time.
Yeah.
So, and then, just like...
Parang nabibuild up, Doc, di ba?
Yes po,
Parang,
and then,
oo.
marami din naman po ibang factors dito.
Mm-mm.
So, yun po, kung sabay-sabay po yung mga yun, and then, yun, burned out po. So, i-assess po kung mayroon na rin pong depression. Kasi, may point po na aalisin mo lang yung stress. You will just...
Go back to your old self.
Opo, hindi pong ganon.
Mhm.
Opo. Pero kung inalis na po yung stress and hindi pa kayo makago back to your own self, baka ibig sabihin na affect na po yung balance ng neurochemicals. That's how we say it simplistically. Na-affect na po yung balance ng neurochemicals to the point na there is already an illness. You might need the medication to just help you balance. So it doesn't mean naman po na if you're suffering from burnout, you stop working. Maybe you just have to see how you can burn off those stress hormones, yung mga adrenaline mo, and get some time for relaxation. Just a thing about relaxation, kasi ang burnout or stress kasi it's a fight-flight response, no? Mataas yung ating mga adrenaline, ganyan. But then, we also have a natural relaxation response. But the thing is, ang stress response and relaxation response are like a seesaw. When you are stressed, mataas yung fight or flight response mo, no? Pero kung hahayaan mo lang yan, you allow yourself to relax, it will go like that.
Okay.
Yeah. That's why we have to exploit our relaxation response, and we can even encourage our bodies to go into that relaxation response by engaging in physical fitness, yoga, mga ganyan, mga meditation.
Gamot naman, Doc Gwen. Generally, kasi ang daming, siya nabanggit ko kanina, may mood problems, anxiety problems, depression, iba-iba yung gamot.
Okay.
So, paano to? Paano
Okay. So, siguro ang question mo, Dr. Tong, is kailan natin masasabi na mag-stress management ka muna or maggamot
Or
ka?
maggamot.
Ay, opo.
Sige. So, siguro, so we have a criteria na naman. If it's very severe na naman at namimit ang disorder, then kailangan maggamot ka. No? Pero sinasamahan pa rin ng stress management. No? Kung hindi naman ganun na disorder, stress management muna kung burnout. So, yun, kung less severe. So, it depends on the severity. And then you're asking about kinds of medicine.
Kasi di ba sa hypertension, may gamot, may lifestyle change, food, halo-halo din yata.
Yes.
Kasi minsan, kailangan mo maggamot muna bago magkaroon ng effect. Hindi siya as needed.
Yeah. That's something that's very important. Yun din pa, no? Okay, so sa psychiatry, that's the reason na we are encouraging psychiatry outpatient consultation. Kasi ang paggagamot po is hindi lang 1 week, hindi lang 2 weeks. And the way I explain it to patients is, kunwari sa mga patients na may depression, no, sabi ko, pero it's a very simplistic way of explaining. Kunwari, naubusan ka ng serotonin, yung happiness hormone, ganyan. And then you take in yung medication, it's going to spark a little serotonin. You'll feel better after about 2 weeks to 1 month. Pero, parang parang yung tangke ng tubig na naubusan ka. Di ba gusto mong punuhin yun? That's why you have to take the medication for a longer time para ma-build yung reserve.
Dito, Manang Lucy, dito sa Baguio Gen, we have mental health coordinators per department, per unit, per office. Kasi nga workplace yung triennial team. I don't know how they do it in other institutions. Paano bang pwedeng gawin nun bilang advanced comprehensive center ang Baguio Gen?
Oo. There was a time, especially nung kakalabas ng mental health law, mga classmate ko nagtatawag, mga doctors, mga school physician, mga physicians. Gwen, paano bang gumawa ng mental health in the workplace?
Yes.
So, Doktong, yun nga at least dito may psychiatry kasi kaya gumawa tayo ng mental health in the workplace. Meron na rin tayong mental health workplace policy.
Yes.
So, it's also advised na for other institutions, magkaroon sila.
Kasi meron po tayong sick leave, may rehab leave. Pero yung mental health leave yata is still in the works kung paano siya i-define. Kasi dapat psychiatrist ang nagsabi niyan. Psychiatrist ang magsasabi na yes, you need a mental health
break. Yeah.
Pero hindi natin na. Ngayon nagiging aware na tayo dito, Doctor. Do we have enough psychiatrists in the Philippines?
I think worldwide, hindi rin eh.
Hindi rin?
In the Philippines. So, nung pag-start ko ng residency about early 2000, ang bilang ng psychiatrists is mga 450. 50. Mga ganun, for mga
National
less than
po yun,
500
Doc.
National.
Oh.
Sa ngayon po, 2024, a little more than 500. Ano?
May iba pa ba tayong activity, Doc Gwen?
Ah,
Di ba pwedeng whole year round?
no. Anyway, ito naman pong mental health weeks, annual naman. So, next year po ulit, makakaroon po ulit.
October ulit.
Yes.
So, any parting words po, Doc, sa ating mga listeners and viewers po?
So, ayun, take care of your mental health. We are always here in BGH Psychiatric Department to help you. So, yun po sa mga nagtatanong kung saan po ang affordable na psychiatric treatment dito po, no? Dito ang best po. Kami ni Dr. No? Bilib na bilib kami sa homegrown po kasi kami.
Taga-Baguio dyan talaga.
Taga-Baguio dyan talaga kami. And yun nga isa, please do not hesitate to contact us. And yun lang po, no, kung magpapa-appointment, syempre, appointment, hindi po on the day itself. Pero you will be assessed if urgent po yung case ninyo, then you will be consulted kung urgent or emergent.
Manang Lucy, actually, pinaka-importante po dito yung nabanggit ng mga simptomas, yung lack of sleep, or sumobrang pagtulog, lack of interest, wala nang gana, or sobra-sobra naman yung, for example, pagkain. Itong mga simptomas na to, kung napapansin niyo po sa sarili ninyo, sa mga kasamahan ninyo, kapapanggihan ninyo, siguro huwag mag-atubaling magpa-check up na po kayo. Dito po sa Baguio dyan, marami pong doktor dito na makakatulong po sa inyo. Ayun po, Ma'am Lucy.
Okay, thank you very much, Doc Gwen and Doc Tong. Again, so there you have it. Kayo pong mga aming tagapanood at tagapakinig dyan. Marami ho tayong resource dito, no, na narinig po natin ngayon na the Psychiatric Department has a 40-bed capacity facility that can accommodate yung mga severe cases po natin. But apart from that, it's so encouraging to know that even in our primary health facilities, kagaya ng ating mga ang tawag namin kasi sa barangay health center eh. So kahit nasa barangay based na health center, meron na pa rin palang kakayahan na pwedeng makatulong sa atin na sila ang first point of contact ba? Is that correct, Doc? So bago po tayo, depende po sa ating simptomas na nakikita sa ating sarili o sa mga kamag-anak natin o kaibigan, ay marami po pala tayong malalapitan. So first line of contact would be our primary healthcare sa ating barangay health center. Maraming salamat po sa ating mga doctors dito, lalo na kay Dr. Gwen. At saka kami bumabati rin sa grupo ni Doc Gwen sa kanilang pagse-celebrate ng Mental Health Week. Ang pinaka-culminating activity is a fun run and will be participated in by everyone. It's open to the public, so when you have time, please join them and be a part of the movement that is more inclusive po tayo at saka magtulong-tulong po tayo para mawala na po yung societal stigma po sa ating mental health disorders. So again, this is your Manang Lucy. Maraming salamat sa inyong pakikinig at sana ito po ay nakapagdulot ng bagong kaalaman at na nating pwedeng i-share sa ating mga kapatid, kamag-anak at mga kapitbahay. So maraming salamat and good day.